All right. Hi, everyone. My name is Ike Hasley. I will be giving a talk called Common Soft Tissue and Overuse Injuries. This is for the Charterhouse Lecture Series through the Mayo Fellows Association, which will be airing on November 22nd, 2021. A little bit about me. I grew up in Cedar Rapids, Iowa. I went to undergraduate at St. Louis University in St. Louis, Missouri. Was back at the University of Iowa for medical school. And I'm now at Mayo Clinic here in Rochester, Minnesota. I'm a fourth-year resident in physical medicine and rehabilitation. And I'll be applying to a sports medicine fellowship for this upcoming year. A little bit about physical medicine and rehabilitation before we start. So this is somewhat of a niche field in medicine, and really our primary goal is to improve people's function, and often that function can be in a pain-free way so that they're able to enjoy the activities that they like to enjoy throughout everyday life. And so this is a very broad field. It ranges from pediatrics to brain injury medicine, people who have strokes, people with spinal cord injuries and need rehabilitation after their hospital stay, as well as other things like cancer medicine, and amputee medicine. And then lastly, the sports medicine field and the pain medicine field are also areas that we can specialize in. And so a lot of times we are dealing with either tendon injuries or overuse injuries. A lot of times these overuse injuries come in the form of like a soft tissue injury. And so that's kind of the area that we're going to be focusing on today. As far as disclosures and statements, I don't have any financial disclosures or conflicts of interest. One thing that I am going to say is that a lot of times for these tendon injuries or these chronic overuse injuries or tendinopathies, which we're going to talk about in a little bit, many of these treatments are off-label medications, as in they're not approved by the FDA. And so that is just something that I want to preface with. And then this educational series is not intended to replace any patient-specific medical advice. And so for specific issues or injuries, I do advise that you see your primary care physician. So the learning objectives for today, what we're going to do is define tendinopathy and describe the mechanism of injury that causes tendinopathy. We're going to review common areas of soft tissue and overuse injuries, and we're also going to discuss typical treatment options that are often used for some of these injuries. So just a little bit of an introduction. So what is a tendon, first of all? Tendons are soft tissue structures, and these often connect a muscle, such as here in the forearm is the example that I'll kind of demonstrate with my mouse here. They often connect muscles to bones, and so they're a little bit more firm than an actual muscle itself, and they're very good at attaching these softer tissues to these harder tissues like bones. These are usually composed of type 1 collagens and a mix of what are called proteoglycans, glycosaminoglycans, and other collagenous type fibers. These are often arranged in parallel fibers, and this allows for great tensile strength. So if you can imagine a rope, they really provide resistance to any pulling of the rope in that certain direction. However, just the way that they're made up makes them a little bit more susceptible to poor healing. There are various structures that will surround a tendon, such as a synovial sheath or a peritoneum, and this can protect the tendon itself from any friction that may occur. And this is demonstrated in an Achilles tendon over here, where we have smaller parts making up the inside of this tendon. And in this example, there's a peritoneum which surrounds this tendon and kind of gives it some protection for any friction forces that may develop. And throughout various parts of the body, there's different tendons kind of have these different protective or defense mechanisms, if you will, in order to protect themselves for whatever situation or environment they are in. In terms of tendinopathy itself, so tendinopathy is kind of this broad umbrella term. Other things that tendinopathy has been called is a tendonitis, which is really just referring to like some inflammation in there, as it was often thought that there would be increased inflammatory cells in a tendon when it's having any issues. It can also be called tendinosis, or if you have something like a lateral epicondylalgia, that would be referring to your lateral epicondyle here at your elbow, and the algia means that there might be something going wrong. Tendinopathy refers to pain, like I said, is this umbrella term which refers to pain and essentially loss of function that's often in the form of loss of strength at a tendon site. This is often due to the degeneration of the tendon itself. The collagen fibers can become disorganized. There can be some inflammation or some increased swelling there. You can have thickening or even some partial tearing of those tendon fibers. And a lot of times this can be due to like a micro trauma over time where, you may not have a full tear in the tendon itself, but some of those fibers can get a little bit just disorganized or separated within the tendon. And this is just a slide that's taken from Up to Date, which is a common reference site that physicians use that describes some of those abnormalities in different tendon examples. When this happens, the body tries to repair that tendon itself, and often it will go through a process called neovascularization, which is where kind of new tendon might try to form, and this can be through blood vessels. This should say blood vessels or nerves, and when those nerves kind of grow in and those blood vessels grow in, that can be really painful. So that's often a reason of pain or discomfort at that abnormal tendon site. So why is tendinopathy important, and why even talk about this? So chronic tendon problems account for a significant portion of physician primary care and sports medicine visits each year in the United States and throughout the world. Musculoskeletal disorders in general make up more than 1/3 of all workdays missed, and of these, a significant proportion, up to 65% or so in this particular study, found to be related to repetitive trauma disorders such as tendinopathy. This diagram over here is just kind of an attempt to explain what happens. So if you have a normal tendon throughout everyday life and you experience this excessive load or other factors, then you can kind of get somewhat of a reactive tendinopathy. And if that's not able to, if our load is not able to be modified, if we're not able to rest that tendon, then we can go into tendon disrepair and a degenerative tendinopathy. On the other hand, if we're able to kind of reverse some of this, then we might be able to get into that adaptation cycle, and we'll maintain this normal tendon tissue. So really what it boils down to in terms of why would a tendinopathy or a tendinous process, abnormal tendinous process occur? It often boils down to excessive mechanical load across a specific tendon in relation to its conditioning. The load or the insult is often out of proportion to that tendon's really ability to heal or regenerate itself. And so this can be certainly different for everyone. Some people might have, one thing that we found is people who do strength exercises, those tendons might be a little bit more resistant to any sort of abnormal change or increased load. This is a chart again from Up to Date about some risk factors that might cause an overuse tendinopathy. So anyone over age 35 years old is at an increased risk factor. Obese individuals have are at increased risk for undergoing tendinopathy. Any prior tendon injury, if there's any anatomic or biomechanical abnormalities. Gender can influence this. For example, patellar tendinopathy is about 5 times more common in males. And when I say patellar tendinopathy, I'm referring to the knee, the patella of the knee is more common, about 5 times more common in males than females. Whereas a lateral elbow tendinopathy on the outside of your elbow here is pretty evenly distributed between males and females. Certain medications can cause this for various reasons, such as antibiotics, statin medications, in comorbidities such as diabetes, rheumatologic disease, other kind of vascular diseases. And that is thought to be due to the way that blood supply is able to get to the tendon. People who have improper training technique, poor movement patterns, poor postural or ergonomic patterns, and then also poor equipment can also be at increased risk for suffering from tendinopathy. So what are some of the treatment options for a tendinopathy or a tendinitis? The first thing that we want to do is modify the activity. So I'll keep using the lateral elbow as an example. If someone is playing a lot of racket type sports and their elbow tendon starts to give them pain, then really what we want to do is rest that up and allow it to give itself some time to heal. So we often use the Price principle. This can stand for protect or isolate that from any further damage, rest that area, provide some ice in order to decrease some of the possible swelling, compression and elevation, and that's to kind of get that the edema out of that area. Really a first step that we often like to use to help with this is to refer to a physical therapist. They can look at some of those techniques. If someone has a postural abnormality, they can help them develop some exercises in order to try to improve that tendon's structure. One thing that we found in the literature is that progressive tendon loading, so really putting some force through that tendon is helpful. And it's thought that this can stretch the muscle that is involved with that tendon, and it can increase the type 1 collagen fibers, which we mentioned earlier makes up these tendons. It can increase the synthesis of those fibers and also kind of teach them to line up in a certain way in order to withstand those forces. We mentioned a little bit about ice for edema relief, but also for pain relief, kind of mixing up ice and heat. So maybe doing 10 minutes of ice and resting, trying some heat as well to get some blood flow to that area. Medications for pain relief. Again, anyone should consult their primary care physician before starting new medications, but Tylenol is really a medication that can alter the way that your brain interprets some of these pain medications. NSAIDs, or non-steroidal anti-inflammatory drugs, such as ibuprofen or naproxen, can help with the edema control. These are known to cause some side effects, such as GI side effects. They can affect your heart and kidneys as well. So again, talk to your physician before starting any of these. Some topical medications for pain relief. Lidocaine is essentially an anesthetic. Many people have had this at the dentist office if they ever have to have dental work. That can be rubbed onto the skin and really doesn't have to diffuse that far, maybe only a couple millimeters before getting to that affected area to provide some relief. Voltaren gel is now an over-the-counter medication. It used to be a prescription medication that can be used as well to potentially decrease some inflammation in that area. And then lastly, there's been some studies about nitroglycerin patches. So this is really a vasodilator, and nitric oxide is the active ingredient here. And this is a potent signaling molecule that can possibly, is thought to possibly stimulate collagen synthesis in the tendon cells, and may have other effects as well. And so this medication is currently being studied. This can lead to some lightheadedness or some low blood pressure. So again, we use caution when prescribing this medication. Kind of moving up the ladder, and we're going to start at kind of the base of the pyramid in terms of more conservative treatments to more aggressive or invasive treatments here. Extracorporeal shockwave therapy is somewhat of a new technique that's being studied quite a lot for these overuse or tendon disorders. And what this does is these devices that I'm pointing to with my mouse over here, these devices deliver direct and indirect mechanical forces. And this is thought to cause some microscopic interstitial. So within that tendon substance itself, some of those cellular changes or extracellular changes that can potentially lead to tissue regeneration. Some studies currently, depending on the body part, suggest that this extracorporeal shockwave therapy, or just ESWT or shockwave therapy for short, can have similar effects to some of the more invasive injections that we do. We really like this for, especially if we see like an athlete in the clinic. This is really great for an in-season athlete or someone who can't really take the time off to rest that particular painful body part area, because we don't have to put anyone in a cast or make them rest for a long time after this. Next, we have one of our injection options that we use quite frequently is a corticosteroid injection. So these are powerful anti-inflammatory medications. Some people know these as cortisone injections, and we use these in different joints such as knee and hip joints as well. And the goal is to decrease the inflammation in this area. We are starting to realize that these corticosteroid injections can have some adverse or bad side effects. And so we like to, most of the time, avoid injecting these medications into the tendon itself, because this can certainly weaken the tendon, and we don't want to take a small, somewhat painful problem and make it turn it into like a larger tear. And so we often inject these into the sheaths or the bursa around that tendon area instead of the tendon itself. This is a picture of an ultrasound machine. And so my specialty, physical medicine and rehabilitation, will use these ultrasound machines, and essentially it's like a little, it looks like a little TV remote where you put that on the body part that we're trying to look at, and we can see the tendon and the tissues itself. And I'll have some examples here in the next coming slides. And we can also see our needle to deliver these medications. And that just gives us very high confidence that we're injecting the medication into the correct spot. In terms of other treatment options and injections, there is this new and growing field of what's called regenerative medications or orthobiologics. This is a picture of Dr. Jay Smith, who was a physical medicine and rehabilitation and musculoskeletal and sports ultrasound kind of guru. He really invented this field, if you will. And so this that he's looking at right here is a vial of platelet-rich plasma. And so what we do is we take someone's own blood, we spin it down in order to get a very high concentration of platelets. And these platelets contain different growth factors. That's thought to kind of signal your own body that, hey, this area is hurting and painful and is trying to heal itself. And that stimulates the body to even send more growth factors there. This has been pretty well studied, and there's still a lot more research and studies to go, but there is thought to be some benefit in a platelet-rich plasma injection, especially at the lateral elbow and the outside of the hip, the gluteus medius area. There are some more mixed results for the patella and the knee and the Achilles at the heel. And then the one thing to note about this is that it often takes about 3 to 6 months or so to really see that effect. Some people see it in a couple of months, but it is thought that this might provide a longer lasting pain relief than a typical corticosteroid injection. Other injection treatment options. So it seems like pretty much every other day you hear about this new stem cell treatment option in the news. And so this is certainly a controversial subject. There's even some debate within the healthcare community itself in terms of what constitutes a stem cell and what do we call these cells. Some people call them mesenchymal stem cells or medicinal signaling cells. Again, trying to get the body to send, it's sending up signals to try to get the body to repair that area. Some things that we do in our clinic is bone marrow aspirate concentrate. So we're basically taking a needle and pulling out someone's bone marrow and trying to isolate those cells. We can also do this with someone's belly fat, a microfragmented adipose tissue, or an MFAT or a lipogems procedure does something similar. There's also other products that we can use, such as amniotic tissue, and there's others as well. Really, this talk is not going to focus a lot on these, but there certainly is some caution with these because we'll see some studies come out, and really we don't know exactly what people are injecting or treating someone with. And so again, this is kind of meant as a word of caution, as there is a lot of forthcoming studies that we need to do to really make sure that these are safe and effective. Other treatment options that I've kind of listed as minimally invasive, as in they're a little bit of a step up from just a simple injection. So there are things that we can do, such as a tendon scraping in. Like I mentioned earlier, when those new blood vessels and those new little nerves form around and into that tendon, we can actually scrape some of those off without going into the tendon itself, in order to try to come up with some pain relief. So once we kind of scrape those little new nerves out of there, people can get relief from that. This device is called a Tenex device, and this is used to perform a tenotomy. And so this is kind of a larger needle. There's some water or saline that's pumped in through this needle, and it irrigates at the tip and uses some mechanical forces to really break up any calcific or any scar tissue in the tendon itself. And it also sucks that kind of dead or useless tissue out as well. And so this is really kind of like a mini surgery that we do under ultrasound guidance. And usually people have to rest for a relatively longer period of time before going back to their activity after doing this procedure. And then lastly, kind of the more invasive procedures, I listed this under surgery. These can be an open or an arthroscopic surgery, in which a surgeon will go in there. He'll identify any tissue that's degenerated within the tendon, and they might do a little debridement or a release, and they can even do things like tendon transfers as well. But I'm not a surgeon, so I can only speak very limitedly on this, if at all. So what are some of the common areas throughout the body that are affected, that we see tendinopathy in? Really, the answer is almost any joint can be affected. Any joint region can be affected. And so this is the shoulder, and this is someone's collarbone coming across. This is their humerus, or their upper arm bone up here. And their rotator cuff is really holding that arm bone towards the body. And so this is a really common area that people can have issues. They can have impingement syndrome, where the tendon kind of gets pinched down by this overhanging acromion part of the shoulder girdle. They can have a partial or a complete or an incomplete tear. And they can also just have some of that overuse tendonitis that I talked about earlier. So one thing that we'll do is we'll take a needle using ultrasound, and we'll introduce some medications such as corticosteroid into the bursa overlying this area to try to provide some symptom relief. This next slide is just an example of that. So someone's holding a transducer over the shoulder, and they're using this needle right here to get some medication into that subacromial or subdeltoid bursa. And we're very confident that we're getting that medication right into the exact spot that we need. Going down the arm and looking at the elbow. So lateral epicondylitis, which I've referred to a couple of times, is right out on the outside of the elbow here. This is often called tennis elbow. If you think of a tennis player doing a backhand, they can really put a lot of stress through this area. Medial epicondylitis is more on the inside of the elbow, and this is called golfer's elbow. This is often seen in a lot of overhead throwing athletes. And so these are certainly common areas that tendinopathy can occur. The initial treatment for these, along with the price or the rest, ice, compression, and elevation principles that we talked about earlier, some of our physical therapists are really good about analyzing. If it's an athlete, they can analyze their grip or their swing modification. As we see, Tiger Woods here is really putting a lot of force through that elbow from here to here, whereas Mr. Nadal over here, you can see how much stress is going through that elbow joint. We can even modify equipment. The thought is that if you loosen up the strings of your tennis racket, that might dissipate some of that force and save some force going through the elbow. This is an example of a pathologic lateral epicondyle tendon. So this is called the common extensor tendon. It's where the muscles in the back of your forearm attached to your elbow up here. And this is an example of that neovascularization, or those new tendons and nerves developing here. We put a Doppler on the ultrasound. We can see that there's a lot of new blood vessels being formed. And so this picture on the right is another example of that needle coming in. This is the Tenex device. It's a little bit thicker, and it's really just debriding and sucking out some of that pathologic tissue. This is an example of the inside of an elbow, and this is a platelet-rich plasma injection being delivered to the inside of the elbow here. So again, we see that needle coming in, getting right next to that bone. They might be breaking up some of that tendon and delivering that medication there. Trigger finger is another tendon issue. This is called stenosing tenosynovitis. So everyone has these little what they are called pulleys within their finger, and it helps keep that tendon tacked down to your finger so that you can make those little fine movements. And sometimes if there's any sort of inflammation, a painful nodule can form there, and this gets caught often and can cause triggering. So someone's hand can get stuck open or shut and can be quite painful and limit what they can do. Again, initial treatment might be some grip modifications, resting that area, putting a splint on it at night in order to decrease some of that inflammation. But if that doesn't work, one thing that some of the providers I've worked with have said is that this is one of the few musculoskeletal problems that a steroid can actually cure. So if we can decrease that inflammation that we see right here, this is the pulley itself, and it's kind of catching this tendon that's trying to run along underneath it. If we can decrease that inflammation, it might take 1 or 2 corticosteroid or cortisone injections, then we might even be able to cure this. If that doesn't work, you can have an ultrasound guided or a surgical release where we just cut through some of this area to free up that tendon and give some pain relief. Looking at the lower limb, the hip is a very common area that people will have tendon issues at, and this is mostly due to those buttocks muscles or those glute muscles just really not being as strong and as flexible as they should be. So this is a photo taken from the Mayo Clinic website, the lateral hip itself, and sometimes these bursa can become inflamed if those tendons are running over them. Sometimes we see a problem with the tendon itself, and the umbrella term greater trochanteric pain syndrome has been developed in order to try to just lump all these diagnoses into one. Although what we see oftentimes is we can be a little bit more specific when we are able to look at this area with ultrasound. So again, this is a cortisone injection of one of these bursa, and that's that needle coming in and delivering that medication to the area. The Achilles is often involved it's a common area of tendon issue. Again, some more of that neovascularization that we see in abnormal tendons here. As you can see, it's quite thicker over here, this tendon area. And so that thickening also often means that it's a little bit inflamed again, quite a common area. So in conclusion, tendinopathy is a very common musculoskeletal disorder. It's often due to increased mechanical load or stress across that tendon and compared to what it's used to. Treatment options can vary from conservative to minimally invasive procedures to even surgery if other things are not working. More research needs to be done on some of these regenerative or orthobiologic treatments for these conditions, but we are starting to find out that some of them may be effective in letting someone avoid surgery. And here are some of the references that I used and attribute to Mayo Clinic and our multiple locations. And this is my contact information if anybody has any questions or concerns or other thoughts. So I would like to thank you for your time, and I really appreciate everyone listening.